Question 1. If a home care client burns his hand, you should A. Apply cool water, B. Call the ambulance, C. Cover burn with butter, D. All of the above. Answer A. Explanation. If a client has a minor burn, soak the burn in cool water for 5 minutes. This will relieve the pain and reduce any swelling. Gently dry the area and apply aloe vera cream or an antibiotic ointment. Place a dry gauze dressing on the burn. If the burn area is large or if blisters developed, seek medical attention. Question 2. While caring for a resident, you hear the fire alarm ring. What should you do first? A. Close the resident's door and any open windows. B. Ask the charge nurse what you should do. C. Begin gathering the resident's personal items. Answer A. Close the resident's doors and any open windows. Question 3. When a seizure occurs, what should you do? A. Move objects away from which may cause injury. B. Place fingers in their mouth to prevent choking. C. Leave the client and run for help. D. Restrain the client to prevent injury. Answer A. Explanation. When a client has a seizure, first prevent injury. Ease the client to the floor and place them on the side. Clear the area of any objects that could cause an injury. Put something soft such as a pillow or folded blanket under the head. Loosen the collar and remove eyeglasses. Always time to Caesar and call 911 if it lasts longer than 5 minutes. Question 4. How often should a CNA renew their CPR card? A. Every 2 years. B. Every year. C. Every 6 months. D. It never expires. Answer A. Explanation. Although a facility can determine if more frequent certification is necessary, most facilities require that CPR certification be renewed every 2 years. The American Heart Association and the American Red Cross CPR and First Aid cards are valid for 2 years. For facility or employee CPR certification must be current and on file when the facility is audited for accreditation. Question 5. The nurse aide finds a conscious client lying on the bathroom floor. The first thing the nurse aide should do is A. Help the client into a sitting position. B. Check for signs of injury. C. Offer the client a drink of water. D. Call for help and stay with client. Answer D. Explanation. When encountering any type of emergency situation, such as finding a client on the floor or an unconscious client, always call for help first. Others can clear the area, phone for an ambulance, assist with CPR, help move or transfer the client, or document the events. Question 6. What is the CNA's responsibility after calling a code blue? A. Assume responsibility for the code blue. B. Participate as a full team member. C. Leave as soon as the code blue team arrives. D. Be available for any necessary task. Answer D. Explanation. As a CNA, you must call for help, get the patient into a flat position, and begin CPR. When the code blue team arrives, allow them to take over. Be available for any requests such as documenting the code, getting equipment, keeping the area clear, taking blood to the lab, or making phone calls. Question 7. While getting a bed bath, a patient suddenly had a difficult time telling you that he is feeling weak on one side. The CNA should A. Report this to the nurse immediately. B. Reassure him that this is normal for his age. C. Pass it on at the end of the shift. D. Prop him up with pillows on the weak side. Answer A. Explanation. Strokes cannot go without warning. Remember the acronym FAST, F-A-S-T, to identify early signs. F equals face drooping, A equals arm weakness, S equals speech difficulty, and T equals time to call 911. Notify the nurse and call 911. If treatment is given within a short time, recovery is possible for a stroke victim. Question 8. While helping an 86-year-old male resident get ready for bed, he tells you that he is tired of living and has been saving his pain pills. What should you do? A. Go through his belongings and search for the pills. B. Notify the nurse and stay with the resident. C. Make him give you the pills so you can flush them. D. Ask him why he feels his life is so worthless. Answer B. Explanation. Studies show that depression is a common cause for suicide in the elderly. White males aged 85 years old and older are at the highest risk for suicide. Never dismiss a threat of suicide. Always notify your supervisor so the resident can be evaluated and treated. Question 9. Mrs. Jones has been throwing up for several days, unable to eat or drink. You find her in bed. She is pale, lethargic, and her eyes are dull. She is likely suffering from A. Congestive heart failure, B. Hypovolemic shock, C. fecal infection, D. multiple sclerosis. Answer B. Explanation. Water makes up about 90% of blood. During an illness, replacing fluids lost by vomiting and diarrhea is extremely important to prevent dehydration. Severe dehydration can cause a drop in the blood volume, causing very low blood pressure. The result is hypovolemic, low volume shock, a medical emergency. Question 10. A patient complains of feeling short of breath and nauseated. Her face is rapidly turning red. She tells the nurse aide that she did not know where strawberries in the gelatin she ate. The aide should A. Note the allergy on the chart. B. Take away the tray. C. Notify the nurse immediately. D. Tell the patient that fruit is good for you. Answer C. Explanation. For people with food allergies, even a small amount can trigger a severe reaction, including anaphylactic shock that can lead to death. Even if the person has only had mild reactions in the past, immediately report any of the following: shortness of breath, hives or rashes, swelling of the lips or tongue, dizziness or fainting. This is a true medical emergency. Be prepared to do CPR until help arrives. Thank you for watching.